everyone, welcome to my channel. If today is your very first time tuning in, my name is John Jay. I'm a registered nurse, a master prepared nurse educator, and this is Health Talk with John Jay. Now, again, if you are new and maybe wondering what is my background and how it relates to healthcare, I want to encourage you to watch my introduction video to get a little bit more insight into my background, my education, my experience. Okay, just to recap, the purpose of this channel is to discuss topics and then try to address some questions and concerns, to clear up some myth and misconception that we have about healthcare within the African community or whoever may find this information to be useful. So, the topic I will be discussing today, I believe, is one that we'll all find really interesting because one way or the other, we can all relate to it. Either we have a personal experience with it or know a friend or family member who may be experiencing such thing. Now, how many of you can honestly admit that you are afraid of the doctors or going to the doctor's office? I guarantee you, if I should do a survey right now, that number will be really, really high. I'm here to tell you, you are not alone. There are so many people out there that have an extreme fear of doctors. There are people who have an extreme fear of doctors to the point where as soon as they enter the doctor's office, their blood pressure gets really high. They start having heart palpitation. Their heart start racing, skipping beats or beating irregularly. Sometimes they even develop chest pain and shortness of breath. Now, all of these symptoms come about because of this underlying extreme fear that you may not realize. And this fear is so strong that it triggers what is called the white coat syndrome. The white coat syndrome simply means it's something about the white coat that your doctor or your healthcare provider has on that triggers this extreme fear. Okay, so meaning as soon as the doctor walk in and you see that white coat with the clipboard like we have on the diagram on the slide here, something triggers that fear in you and you start experiencing these symptoms. So I'm here to tell you it's okay. Nothing is wrong with you. If you are that person or you know a family or friend who may be going through this, then I want to encourage you to stay tuned and watch this video to the end. So the topic I will be discussing today is, should I be afraid of my doctor? So for today's discussion, I'm going to be discussing some reasons why people tend to be afraid of the doctors or going to the doctor's office, and how can this fear impact or affect your visit and your overall health, and then what are some things that we can do to help, and then I'm going to be concluding this discussion. Now, looking at the first objectives, which is reasons why people tend to be afraid. The first reason I listed is things that may be said or done during the visit. So, for example, fear of being told that based on your test results, you may have this or that condition, or we need to send you for further testing. Now, I don't know of anyone who can honestly admit that they will not be afraid going in. Or maybe you are like me who is afraid of needles or invasive procedure. So, going to see the doctor and knowing that your visit will involve you receiving some type of needle or some type of medical procedure being done, that alone can trigger the fear. Now, if you're not sure what an invasive procedure is, an invasive procedure simply means that an instrument or some type of medical device is used to either puncture or put a hole or cut in your skin by means of entering the body. So an example of some invasive procedure could mean a biopsy or getting an medication injected into your joint, either your knee, your shoulder, or your back for some type of pain that you may be experiencing. Other example could be colonoscopy or a pap smear. So those are just a few examples of what an invasive procedure is. The second reason is maybe you've had a past medical experience or incident that is triggering this fear. For me, when I was maybe like 10 or 11 years old, this was years back in Liberia. I remember getting sick one night, and in the middle of the night, I was so sick, they decided to take me to the nearby hospital. So I remember sitting on a bench inside the hospital in the hallway, and I saw this nurse coming down the hall, and I saw her with this long needle in her hand and just flickering the needle to get the air bubbles from the medication. And immediately I knew she was going to give me an injection. So I quickly ran out of the hospital. I didn't know where I was going. But all I wanted to do was just get away as fast and quickly as I could. So I remember just running and I running. It was so dark outside. I didn't even know where I was going. Next thing I know, people grabbed me and they took me right back in the hospital. They put me down on the bed, and I remember kicking and fighting and kicking and fighting. And I was just kicking and fighting. I was so scared, and I was given that injection. So from that day, I've been so afraid of needle. It's just, lately I'm doing a little bit better, but because of that past experience and that past incident that took place when I was way, way young, like I said, 10 or 11-year old, that fear still with me. So every time I'm going to the doctor and I know I'm going to receive a needle or I'm going for blood work, it always comes back to me. So those are another reason why you may have this fear. So because of a past medical experience or incident that may have happened to you. And another reason, maybe you fear that maybe you will not be understood, or maybe you will be judged because let's say you may not be able to fully express yourself or explain to the doctor what is actually wrong with you or your symptoms. So the fear of being misunderstood or judged can also trigger that fear. And then lastly, I listed is not understanding the medical jargon or the medical language. Because sometimes as healthcare provider, we are so used to speaking in a certain way and using certain terminology. So sometimes we forget or we become so comfortable and we just speak, without thinking that maybe the person that is sitting across from us may not be understanding well what this means or what that means. So the fear of not understanding the medical language or the medical jargon can also be a reason why people tend to be afraid of going to the doctor. So how can this fear affect or impact your visit with the doctor and your overall health? Now, the first thing is it can prevent you from fully expressing yourself or telling the doctor what is actually wrong with you. So, going into your visit, you may have had all these questions and concerns that you wanted to bring to the doctor's attention, but because of this fear that overtakes your mind, you walk in and everything goes away. So, you forget what you wanted to tell the doctor, you forget about your concerns. So, it can affect you from fully expressing yourself to the doctor. The next thing is it can potentially lead to wrong diagnosis, wrong testing, and wrong treatment. Now, I want to talk about this a little bit more. For example, the fear of seeing the doctor can be so strong for some people that it can raise their blood pressure so high in the doctor's office, even though at home the blood pressure was, normal. Some people may have chest pain, they may have heart palpitation, or even fast heart rate, or their heart will be skipping beats, which is irregular heart rate. Now, if this occurs every time you go to visit the doctor, you may be diagnosed with hypertension, which is high blood pressure, or some form of heart problems, or sent for further testing based on these symptoms when in fact you don't really need it. It's all being triggered by this extreme fear. Now, the last thing I listed is it can potentially prevent you from getting the medical help that you need. Um, so for instance, like I said in the beginning, you have these concerns, you have these symptoms that you've been experiencing at home, maybe for a couple of weeks or a couple of days. But now you walk in, this fear overtakes you, and you forget to mention something that should be mentioned to the doctor that's very crucial. So these are some of the ways that this fear can affect your overall health and your visit to the doctor. Okay, so now let's bring us to our other objective. So you may be asking, so what can I do to help? Like how can I help myself? So there are ways that you may be able to help with this fear. So the first thing I listed is don't go alone. It's better to take a support person with you. It can be a friend or a family member, your neighbor, but it's always good to take a support person with you if you have a strong fear of the doctor. And then the next reason is you want to be open about your fear. Okay, be honest and tell your doctor that you have this extreme fear of coming into the office or seeing the doctor. Okay, and then you want to plan ahead. Write down your questions and your concerns so you don't forget what you want to say or what you want to tell the doctor. And then lastly, well, not last day, but then also, let's say you walk in, and as soon as you walk into the doctor's office, they will take you to the room, and then the medical assistant checks your vital signs, which is your blood pressure, your heart rate, your temperature, and it's high. So, you can ask the doctor to have your vital signs rechecked prior to you leaving. And then lastly, you want to take something that can help you relax. If you enjoy listening to music while you're in the waiting room, you can just listen to music. If you enjoy reading, take a book that you enjoy reading and you can read, and that will help you stay calm and relax before the doctor walk into the room. So these are just some tips that you can do to help with this extreme fear. So we have come to the conclusion of this topic. So to conclude, if you or someone you know is going through this, I want you to know that you are not alone and there is absolutely nothing wrong with you. You are not making this up either. Be honest with your fears. There are different things that you can do to help with this fear. So no, to answer the question from the beginning, should I be afraid of my doctor? The answer is no, you do not have to be afraid of your doctor. Your doctor is your healthcare partner and is there to help you. But in order for this partnership to work or to be effective, there needs to be collaboration, meaning you and your doctor have to work together. There needs to be honesty and transparency. Okay, so you utilize the tips, and then hopefully you can get the best out of your visit with your doctor. We have come to the end of this discussion. Again, I hope this was helpful. If you have any comments, questions, suggestions, or maybe it's something that you are not sure of, feel free to write in the comment section. If you like what you heard, I want to encourage you to tune into my next video. Please subscribe, like, and most importantly, share this video with your family, friends, and loved ones. Be blessed, stay safe until we meet again. Again, my name is John Jay, and this is Health Talk with John Jay. Bye.